Hello, I am Dr. Bishwas. I am a doctor of this clinic. May I confirm your name and age, please?
Yes, I am Mr. Jonathan, 55 years of age.
Okay, Mr. Nice to meet you. How can I address you?
Well, you can address me Jonathan.
Okay, Mr. Jonathan. I have got a letter from your GP saying that you have shortness of breath for last 6 months. Is it right?
Yes, doctor.
Okay, I am going to talk about this issue, and during our conversation, I may take some notes. But all the information during our conversation will remain confidential. So, is that okay for you?
Yes, it's all right.
Okay. So can you please tell me in more details what is happening with you?
Okay. Yes, doctor. Actually, for the last 6 months, I was quite well before last 6 months, but for the last 6 months, I think that I have been facing some breathlessness. I feel shortness of breath whenever I have to do some exercise, some heavy exercise, or some walking for a long distance. Okay, so this didn't occur previously, and at the beginning, I didn't care for it too much. Uh, I thought that it's just some type of weakness, but day by day, I think it's getting a bit worse. Okay, and I feel now br- I feel quite breathlessness. Okay, whenever um, I think I walk for around 10 minutes or 15 minutes, I think that I feel breathlessness, shortness of breath. Okay, and another thing I want to mention that I also have some cough issues. Okay, for the same duration. Okay, for the last 6 months. So this is also a bit worrying for me. And this cough actually changed around 3 months back. I had some fever also, uh, very mild fever, but usually it is dry. I didn't usually produce any phlegm, but 3 months back I had an episode when I produced phlegm, and I went to the GP, and after taking some drugs, some medicine, it resolved, he said. But yet now, breathlessness has not resolved, and now dry cough is also present. Okay, that's why I'm a bit worried, doctor. What's happening?
Yeah, I am sorry to hear that. And, you said that your shortness of breath started 6 months ago. Can you tell me that did
Yeah,
it started suddenly or gradually?
it's gradually, doctor. I think it's gradual.
And is it progressive?
Yes. First of at the beginning, it didn't bother me that much. Okay, I didn't even take it seriously. But now I'm feeling that no, it's increasing. Okay,
Okay. And can you remember that did it started following any abnormal events like any fever, any cough?
no, no, I don't remember anything like that.
Okay. And your shortness of breath when you work or any do any exercise?
Yes. Usually that. Okay.
Have you noticed that you feel shortness of breath during your rest?
No, I think I comparatively feel better when I take rest. But whenever I do some work, okay, I think that it's more.
Have you noticed,
Even
please?
yes, and even when I stand up, I think it's more than sitting down. Okay, rather I feel a bit better sitting down or taking rest.
Okay. Have you noticed any shortness of breath at night?
No,
Did you ever needed to wake up due to shortness of breath at night?
no,
Okay. Have you noticed any swelling in your legs?
no.
How many pillows do you use during sleep?
Yeah, it's one pillow, doctor.
Okay. And with shortness of breath, you said that you can walk 10 minutes or 15 minutes.
Yeah.
And after that shortness of breath, have you noticed anything that what can makes it worse or better?
Nothing, doctor. I haven't noticed anything like that. But I think that just this shortness increases with my exercise or with my normal walking. Okay, for a long period, and when I take rest, I think gradually I feel a bit better, but not. It doesn't go away completely. Okay.
Okay. And does it have any timing when you feel shortness of breath? Any morning time, any evening time, or night?
Well, no specifically. Okay, I think that it is uh, more or less present all the time whenever I do work.
Okay. And do you feel any chest pain,
No.
any tightness in your chest?
Well, doctor, sometimes I feel that I have some tightness in my chest. Usually, it wasn't that much prevalent, but for I think for the last 1 year or so, I sometimes feel that there is some chest tightness, and at times, sometimes I feel that there is some noisy chest, some noise coming out from my chest as well.
Okay. And for 1 year.
Yeah. I think so.
And is it increasing or remain the same?
Doctor, I think it's more or less same.
Okay. Have you noticed any racing or pacing of your heart?
No.
Okay. And you said that you have cough
Yes.
and cough for 6 months. And do you have any timing when you feel more cough?
Cough, no, doctor. Usually, but when I do some work, it's usually a bit more.
Okay. And have you noticed that your cough is more when you are at your workplace?
Well, doctor, I'm not sure about it, but it might be more. Okay, it might be.
Okay. And
I
for the
have a hectic job life. I work as a road builder. Okay, so at times even at off day also I have some shifts. So it's hard to tell whether it's better in my off day or not.
okay, that is not a problem. And also you said that you have cough and you didn't produce any phlegm for
There was just one episode, doctor. I think I had some mild fever 3 months back. Okay. And at that time, I produced some phlegm. And after taking that medication, my GP prescribed me that phlegm went away. But this dry cough didn't go away. It's still present. Breathlessness is also present.
okay. And have you ever produced any blood or have you noticed any blood in your phlegm?
No.
Okay. And is the cough increasing day by day?
Yeah, doctor, both cough and this shortness of breath, both are increasing.
I'm sorry to hear that. And I'm going to ask you a few more questions. That is your symptom affecting your daily life?
Yes, doctor. Now it's affecting. You know that I have been working as a road builder, so we have to do physical activities in the roads. We have to go to the construction sites. Okay, so this is getting a bit hectic for me.
And may I know that I'm sorry to hear that. And I am going to involve the social department so that they can help you in this regard. Okay. And in the meantime, may I know that do you have any headache?
No,
Any changes in your vision?
no,
Any rash anywhere in your body?
no,
Okay. Have you noticed any changes in your weight?
doctor. I think that I have lost some weight, but I don't think it's very much. 2 to 3 kg, I think. I measured my weight around 78 kg in 6 months back, and last month I think it was 75.
And was it unintentional or intentional?
Yeah, I think it's unintentional, doctor.
Okay. And have you noticed any changes in your weather preferences?
No, doctor.
Okay. Any lumps or bumps anywhere in your body?
No,
How about your bowel habit?
it's okay. I think, doctor.
Okay. What about your water work?
Fine.
Do you have any weakness at any side of your body?
No, I haven't noticed, doctor.
Any pain in your joints?
No.
Okay. And do you have any past medical condition that you would like to share?
Well, no, doctor, but I think I have some noisy chest around from my childhood. Okay, and for that, doctor prescribed me some nebulizers, and I've been well since then. And just for the 1 year back, I am also sometimes face that noisy chest again, and I again usually use the inhaler. And after using that inhaler, I think I feel better, more or less. But these symptoms are different. This shortness of breath and dry cough. Okay.
Okay, I'm sorry to hear that. And may I know that what are the medication you're taking?
Yeah, I think it is a salbutamol nebulizer. Okay, at times I take it, and no other significant medication.
Any over-the-counter medication?
No,
Any herbal products?
no,
Do you have any allergies to any medication?
no, doctor.
Okay, I am sorry to ask, but can you please tell me that do you have use any IV drugs or intravenous drugs?
No, no, no.
And any of your family member have any condition that you would like to share?
I don't know of any, doctor.
Any heart problems or any problems in chest?
I don't know.
Okay, that is not a problem. And may I ask you a few more personal questions?
Yes,
Do you smoke?
yes, doctor. That's an issue. I think I
How
smoke
many?
around.
Yes, please. How
Yeah,
many?
yeah.
And for how long?
Yeah. I think I smoke around 20 cigarettes per day, and it's a long time. Around 10 to around 12 years, I think, doctor.
Okay, and this is also related to your condition. And for this, I would like to recommend you stop smoking totally. And if you need help, we can refer you to the smoking cessation clinic. Is it okay for you?
Yes, doctor. Yes,
And do you drink alcohol?
within social limit, very less.
Okay, that is fine. And you said that you work at road builder. May I know that what your job actually involve?
Yeah, actually, I'm involved in both construction and planning. I'm an engineer actually, so I have to go to the construction sites. I have to make the planning. Okay, and we also have to check whether visibly check whether all the works are going right or not. So we have to be in the field.
Okay, and do you need to at the mixer site, like a concrete mixer site or a cement mixer site?
Yes, yes. Occasionally, more occasionally, I have to go there because I have to check every ingredients. Okay,
For how
whether
long
it's
you are
all
doing?
right. Yeah, it's around 30 years now, doctor. I have been in this sector for my whole job life.
And do you use proper mask or any other safety measures at work?
Well, actually, doctor, for the first, I told for 30 years. Actually, at the beginning there were not so much awareness. Okay, but I think we are using. They have our company has given us some protection for the last 1 or 2 years, but I'm not very much concerned about it. So I
Okay, that is
don't
not a
use
problem.
them
I can understand.
usually.
And can I know that do you have any pet at your home?
Yeah, I have a cat, but it's for a long time. I think around 10 years. Not one cat. I have always have cats.
Okay, and whom do you live with?
I live with my wife,
And are they
two
supportive
children.
enough?
Yeah, very much supportive.
Okay, and do you want to add anything?
Well, doctor, not. I just want to know what's happening and what's causing these symptoms.
Okay, to give your answer to your question, I need to examine you, and then I could give you the best explanation. As far as I have taken your history, I came to a few possibilities came to my mind that it can be related to your job, and is most likely related to your job. And we are thinking a cause that is called, we call it pulmonary fibrosis. Have you ever heard of it?
No, doctor, no. What is this?
This is a possibility. It is not. We are not quite sure that what is, but we are suspecting it that there might be some scarring in your lungs, so that you are having this shortness of breath and also having this cough. And for
Okay.
this, your job is also a risky factor for this, and also your smoking habit that they combinedly have cause this. But it can also be some factor that can also be a case of chronic obstructive pulmonary disease, that some scarring in your lungs, and also a big case of asthma that you had previously. And for this, we need to do some blood test, some imaging test of your chest, and after that, we can give you best explanation that what is happening with you.
Okay, well, is it serious, doctor? This pulmonary fibrosis?
I am afraid that it is a condition that cannot be totally cured, and that needs a medication that can need to be taken for life. So after we get the results, we will be in better position to guide you.
Okay, doctor.
Do
Thank
you
you.
have any concern?
No, doctor. Just I would like to be as better as possible. Okay,
Okay, thank you.
okay, doctor. Thank you. Well, so what are your DDs?
Okay, for this gentleman, my first differential is this is a pulmonary fibrosis due to his profession, most likely silicosis, and I also consider this is a case of chronic obstructive pulmonary disease, and I also consider this is a case of chronic asthma, and I also consider this can be a case of uh, chronic pulmonary embolism, though possibility is still least likely.
Okay, okay. And so, if the case of silicosis, what you're telling, then what should be the investigations done?
For this gentleman, I will go for the basic routine blood test, and after that I will go for the chest X-ray, then high resolution CT scan of the chest, then I will go for the pulmonary function test, yeah, and spirometry, and arterial blood gas analysis, and after that I yes, these are this.
Okay, 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 okay. And what can be the management?
Okay, for this gentleman, counseling and educating the patients, then some non-pharmacological managements like avoidance of exposure to silica, then smoking cessation, and after that some pharmacological managements like steroid, and some anti that is called that is for his fibrosis, some drugs like nintedanib or uh, farfenidone.
Okay, 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 okay.
And for this,
Okay, so
gentleman, yes, and for this gentleman, I will involve the multidisciplinary team, that is involvement of as it is a professional occupational health therapist, as it is a occupational condition, and also respiratory and consultant, and also I will social health care worker.
okay, okay, that's all right, doctor. So thanks a lot. You have done prepared really well. Okay. Well, so actually, you cracked the case quite nicely, since it's a long-term history of silico exposure, specifically road building exposure. So this is more likely to be associated with silicosis. And yes, there was actually dry cough and shortness of breath, and you actually evaluated the cardiac causes and excluded them very well. So once they were excluded, it's important to rule out the respiratory causes and to rule out the causes of pulmonary fibrosis. So you actually went very well when you excluded all the rheumatological symptoms, and then it came to other symptoms like other any medication history which can cause fibrosis. These were also excluded. So finally, you went for some issues with his occupation, and that revealed a very important uh, occupational history. So that was very important, and from there on, you moved on very smoothly. That's a point. But however, there were some other points like smoking history and previous history of childhood asthma. So and there was also single episode of phlegm producing sputum. So actually, that was more likely to be an attack of pneumonia, since it resolved very well. And the asthma is less likely to cause this type of symptoms, but this can also be a cause of COPD. However, this is a bit unlikely given the exposure of his exposure of root constructing elements. Okay, so more or less it was very well and very well managed as well. All the symptoms were covered. Okay, so thank you.
So I have,
And
but can it be a case of chronic heart failure?
it can be, but it can be you could have brought up this as a DD, but actually there was no other symptoms. Okay, it was dry cough. It was not that profuse pink colored cough was not present. No other symptom was present, and he didn't give any type of history, previous history of hypertension, diabetes, or any other family history also. Okay, so I think that considering all this, you might have excluded this, but and you have wisely excluded this. But it's true that considering his age, it can come as a DD, and you can put it down as the last DD in this type of cases.
Okay, and another thing that sarcoidosis can be a differential for this gentleman.
Sorry, can you repeat?
Can sarcoidosis be a differential for this type of presentation or for this gentleman?
Yes, sarcoidosis can be, but you ruled it out by asking about joint pain rashes. Sarcoidosis can have some important elements like joint pain, rashes, some changes in the vision, and also sometimes it can cause some diabetes insipidus, I think. Okay, nephrogenic diabetes insipidus, I think. So, sorry, not nephrogenic, cranial.
Yes.
Cranial diabetes insipidus. So sometimes it can cause polyuria as well. Okay, so this nothing was present. Was the water work was okay, no joint pain, skin rash, and no eyesight problem, no redness in the eyes. So I think that it's quite okay not to bring sarcoidosis as a main differential. Okay.
Okay, thank you.
Okay. Thank you, doctor.